Breast health is a crucial aspect of overall well-being, and being aware of changes in your breasts can help you detect potential issues early. Whether it's a subtle shift in texture or a noticeable lump, these changes can sometimes indicate underlying health problems. While not all changes are cause for concern, it's important to recognize signs that may require further investigation. Here are 10 breast signs you should never ignore. 1. A new lump or mass. Finding a lump in your breast can be alarming, but not all lumps are cancerous. Most are benign, such as cysts or fibrous tissue. However, any new lump should be evaluated by a healthcare provider. A cancerous lump is usually painless, hard, and has irregular edges, though this isn't always the case. Early detection is key in managing breast cancer, so it's essential to have any new mass or lump assessed through medical examination or imaging tests. What to do? If you feel a new lump, especially one that persists through your menstrual cycle, schedule an appointment with your doctor for a clinical breast exam and possibly an ultrasound or mammogram. 2. Changes in breast size or shape. If one breast suddenly becomes noticeably larger or smaller than the other, or if there's a significant change in the overall shape, it's worth investigating. While natural hormonal changes can cause slight variations, sudden or drastic changes could be a sign of a more serious issue like breast cancer or an infection. What to do? Take note of when the change occurred and see your healthcare provider if it doesn't seem related to menstruation or pregnancy. 3. Nipple discharge. While nipple discharge can sometimes be harmless, especially in women who are breastfeeding, it can also be a sign of an underlying condition. If the discharge is clear, yellow, bloody, or occurs without squeezing the nipple, this could indicate an infection, hormonal imbalance, or even cancer, particularly if the discharge is coming from only one breast. What to do? Report any unexplained discharge to your doctor, especially if it is persistent or bloody. Further tests, like a ductogram, may be needed to determine the cause. 4. Nipple retraction or inversion. If your nipple, which has always been outward, suddenly becomes inverted or changes position, this could be a sign of breast cancer. Nipple inversion can happen naturally, but if this is a new development, especially if it's only on one side, it should be checked out. What to do? Seek medical advice if your nipple suddenly inverts and does not revert to its normal position. A physical exam and imaging may be necessary. 5. Dimpling or puckering of the skin. Changes in the texture of your breast skin, like dimpling, puckering, or the appearance of an orange peel texture, also known as peau d'orange, can indicate inflammation or a serious condition like inflammatory breast cancer, IBC. This aggressive form of cancer can cause swelling, redness, and thickening of the skin. What to do? If you notice any dimpling or changes in texture, contact your doctor immediately. Inflammatory breast cancer requires prompt diagnosis and treatment. 6. Redness or rash. A red, inflamed rash on the breast that doesn't go away could be a sign of an infection or a rare form of breast cancer called Paget's disease of the breast, which affects the nipple area. An infection, such as mastitis, is more common in breastfeeding women but can occur in anyone and may require antibiotics. What to do? If the redness or rash persists or is accompanied by pain or swelling, consult your healthcare provider. You may need a skin biopsy or mammogram to rule out more serious conditions. 7. Breast pain or tenderness. Breast pain or tenderness is common, especially around your menstrual cycle. However, if the pain is persistent, sharp, or localized to one spot, it may signal something more concerning, such as an infection, cyst, or even breast cancer. What to do? Monitor the pain, and if it doesn't correlate with your menstrual cycle or if it's severe and ongoing, visit your doctor for an evaluation. 8. Thickening of breast tissue. If you notice an area of your breast that feels thicker or denser than the surrounding tissue, it may indicate a benign condition like a fibrous area, or it could be an early sign of cancer. This change may be subtle, so regular self-exams can help you detect any unusual thickness or changes in texture. What to do? Get this checked out by a medical professional. A mammogram, ultrasound, or biopsy might be required to examine the tissue more closely. 9. Unexplained swelling. Swelling in one or both breasts that isn't related to your menstrual cycle, pregnancy, or breastfeeding can be a sign of infection or cancer. If the swelling is accompanied by warmth, redness, or fever, it could also indicate mastitis or an abscess. What to do? Seek medical help if the swelling is sudden, persistent, or accompanied by other symptoms like heat or fever. Treatment for infections usually includes antibiotics, but further tests might be necessary to rule out other causes. 10. Itching that won't go away. While occasional itching isn't usually a cause for concern, persistent or severe itching on your breast or nipple that doesn't improve with over-the-counter remedies could be a symptom of inflammatory breast cancer or Paget's disease. This type of cancer may affect the skin and require immediate attention. What to do? If you experience constant itching on your breast that doesn't resolve with treatment, make an appointment with your doctor. A biopsy may be necessary to rule out serious conditions. Final thoughts. Listen to your body. While many breast changes are harmless, staying vigilant about your breast health is crucial for early detection of potential issues. Performing regular self-exams, being aware of your breast's normal look and feel, and scheduling routine mammograms are important steps in ensuring your breast health. Always consult a healthcare professional if you notice any of these 10 signs, as early intervention can lead to better outcomes. Your breast health matters, and paying attention to these subtle signs could help you catch any issues early, ensuring the best possible care for your long-term well-being.